one more video here about my semester that I just finished last semester in the med-surg whole category. So this last one is about radiology unit that's in the hospital. So that's not an inpatient and outpatient. Both people who are, if they're inpatient or outpatient, they come to the same place and have appointments. So for starters, I love this unit. This is the only unit this entire semester that I loved and that I would work in. So part of it is the environment. I am all about environment. What's my work environment? Like, how do people treat each other? What's the vibe? That's all me. Love it. They were just so chill, like friendly, like laid back, but yet like serious about their job and what they're doing, and so I really liked it. And some people thought it was really boring because you don't do a ton. Like, if they're outpatient, then they will come into you before the surgery, or because there's CT, MRI, and IR, which is interventional radiology. So those are the main ones. And they will come into, the nurses have a little station and some rooms, and they'll come in there first, and you'll get them prepped and in a gown, whatever you need to do to prep them. And then the doctor normally comes in, talks to them, gets the signed consent form, and then you guys are good to go. So the nurse takes the patient there to the room, and the nurse is in charge of like any pain meds or sedation meds, and they gotta know them good, but they give them every couple minutes. Plus they have to check the patient's vital signs every I think it's every 5 minutes. Every 5 minutes they have to be checking and inputting in the computer. So, because the rad techs and the radiologist doctor are the ones performing whatever it is, whatever procedure or running the scans. So that's the nurse's job is to keep them sedated, because by not putting them under with anesthesia, which sometimes they do, sometimes they bring in an anesthesiologist, like maybe if it's a kid or something. Sorry, I lost my train of thought. The nurses give the sedation. They keep them awake. By not putting them under anesthesia, it reduces the risks of the procedure, and it's less invasive. So they just put them under sedation. Plus, some of them, sometimes in case the doctor needs the patient to breathe or something, the patient still has control over their own breathing. So the doctor can always have them do stuff, But it's the nurse's job to really pay attention to that patient, making sure they're comfortable, they're not in pain, because if they are, then the nurse needs to give more meds, or, So, and then if they're an outpatient patient, then they will go back to the room, one of the rooms by the nurse's station with the nurse, and the nurse will keep them there long enough to recover and come out of the sedation, maybe an hour or two, and then they get to go home. If they're inpatient, then like a CNA from the floor or from radiology or somewhere in the hospital will transport the patient down straight to the room and then transport them back. So all the radiology nurse has to do is give the meds. And some people, honestly, some people are whiners, and they just want to be knocked out, and you don't knock them out with anesthesia and they get mad at you. But I mean, you're a nurse, you can't knock them out even if you wanted to, So, I don't have a ton to say about radiology. There's really not a ton that you do as a nurse there, but for some reason I just really liked it. I really liked the vibe and the atmosphere there, and that has always been something that's really important to me, is that wherever I work, it has a really good atmosphere. So, at least at the hospital that I did my clinicals at, it may be different at other hospitals, I'm not for sure. So I hope this video helped you guys, and If nursing is your dream, then go for it. Have a good day.